started. So first, I'd like to introduce myself. My name is Audrey Savage, and I work in the International Marketing and Recruitment Office at Lund University. I'm an International Communications Officer, and I'll be moderating our panel today, where we have 4 fantastic current Lund University students who are all studying different programs within our medicine and health area. We are fortunate to have all of the programs represented here today, which is exciting, all of the ones that are taught in English. And before we get started, I want to also have a few housekeeping notes. First, you can feel free throughout the session to ask us any questions you have in the Q&A. It's at the bottom of the screen. And if you notice that someone else has already asked the same question that you have, feel free to give that question a thumbs up or a upvote, whatever you prefer to call it. And that will send that question to the top of the list so we can make sure we can get to it sooner. So please feel free to use that. I also want to make a note that because we are joined here today by current students, we will be focusing on questions about what life is actually like at Lund, what their experience has been like studying medicine and health, and not on application related questions. We have a lot of different sessions, both that have already happened, that are recorded, and coming up for you that will walk you through all the steps for how to apply. So don't worry about that at all. There will definitely be time for you to get those questions answered if you have application questions. But for today, we want to use our time wisely and make sure that we get to hear from our students. So please keep your questions related to student life and to the experience of studies here at Lund. So without further ado, I'd like to introduce our panelists today. So we'll go around and perhaps you can tell us who you are, where you're from, what you study, anything else you'd like. We'll start with Catalina.
Yes, hi, my name is Catalina. I'm from Colombia. I'm studying Master in Public Health. My background is in psychology and I'm currently in the 2nd year.
Great, thanks. Justice?
Yeah, hi everyone. I'm Justice from Ghana, currently studying at the master's level in medical science with a specialization in nursing. My background is a mental health nurse. Yeah.
Great, thanks. Agnes?
Yes, my name is Agnes and I'm studying my master's in biomedicine. I have previously studied the bachelor's as well here. So I'm in my 5th and final year and I'm from Sweden.
Great, and Samu?
Hi everyone, I'm Samu. I'm from Zimbabwe. I have a background, I'm a dental hygienist and I also studied development studies. And yeah, I'm also a 2nd year in the same class with Catalina. And I'm also a student rep for my class.
Great, wonderful. Well, thanks so much for being with us here today, guys. I think the first thing I want to ask from everybody is, what's your favorite thing about studying your program here at Lund and studying within the medicine field at Lund? Perhaps we'll go back around the other direction. So we'll start with you this time, Samu.
Okay, so I think my favorite part about the program is there's a lot of nationalities. So I get to know about a lot about what is happening in other countries because my classmates talk about it. So that has been really exciting. It has opened up the world to me. Besides learning about public health, I'm also learning about other cultures and practices around the world.
Yeah, thank you. That's really exciting to hear. That's one of the things we really pride ourselves on at Lund, that we have students from over 130 countries. So most of the programs you'll find have quite a diverse range of students in the class, which is always great. Agnes, how about you? What's your favorite thing about studying biomedicine?
I think it's, of course, similar that you have a lot of different nationalities and you learn a lot from each other because you have different backgrounds, at least in the masters. So you have different kind of skill sets, which is very beneficial when it comes to group work. But I think just in general, I think biomedicine is quite cool because you kind of look at the smallest building block of the body and really kind of see what malfunctions. And I think that's really neat. And it's a lot about understanding diseases and discovering new drugs and ways to do it. So I think it's really cool.
Definitely, and a very important topic right now with the global situation we're in. Great,
really
thanks. Justice?
Yeah, so what I found intriguing is the teaching methodology because it's been my first time trying to do a presentation on almost every examination seminar that I have, which is quite different from where I come from. And initially it has been challenging, but I think now it's very good, and I'm getting used to that. So that is what I found intriguing studying in Lund. Yeah.
Great. And that's definitely something I want to dive into later as well, what you've been surprised by and the differences in studies. But Catalina, would you like to share your favorite thing?
Besides the fact that Samu shares about that it's important that you get familiar with a lot of, for instance, healthcare systems from around the world and everything, it's also interesting the fact that we have access to a lot of research options during the masters. So we can talk, for instance, with our professors about what they are pursuing right now, and also start to figure out what we want to learn like deeply in the future. So it's interesting. I like that.
Oh, that's great to hear. I'd also be really curious to learn from everyone why you chose your programs in particular and why you chose Lund. I know, Agnes, you might have been a bit more familiar coming from Sweden with Lund, but for everyone else especially, how did you find yourself at these programs? Perhaps this time around we'll start with Justice.
Okay. This I don't know how it happened though, but it's happened that I was looking out for a university to study abroad. So while on the net, I just came across schools in Sweden. So I decided to give it a try. I didn't have any idea about Lund, but when I got in, it became interesting. I said, no, let me give it a try. So at the end of the day, I landed here. The surprising thing is that it was my third year of application. That is when I was able to really get here. But it's nice, and everything about Lund, I think I love it. Yeah.
Oh, that's great. Well, we were happy to have you here in the end. Agnes, what about you? I know you kind of probably knew a bit about Lund already, but what drew you to biomedicine as the field?
I think I'm going to be just completely honest. I was not sure after high school what I wanted to do. So I took a year off, and then I kind of just came over biomedicine by chance. So I thought it was really cool. So I applied, and I thought it was really interesting because I me myself, I have an autoimmune disease. So I thought it was cool to kind of understand the knowledge and everything, the mechanism behind it even more. So that kind of drew me, and I was more eager to apply, and I was really happy when I got admitted. So, and Lund is such a nice city. I've been here before when I was younger, so it felt like a given choice for me.
Absolutely, great.
Yeah.
Samu, how about you? How did you find public health in Lund?
For me, I was just looking at options in Sweden, and then my friend suggested that you should look at which are some of the best universities in Sweden, and not just pick a place, you know. So Lund came up as one of the best rated university. So that was my first choice. And also I think because it was quite close to Denmark, but I didn't realize how close then. So I was like, it would be nice to be closer to somewhere else as well. So that's why I chose Sweden. And also I wanted to avoid the cold. My friend had been studying here the previous year. So she said, try not to go to the north because it's really cold and I don't like the cold weather. So Lund was at the top of that list, fortunately.
Yeah, absolutely. I think if you're trying to avoid the cold, but you still want to be in Sweden,
yeah,
we're about as south as you can get. For those in the audience who don't know much about Lund or our location, we are, as Samu mentioned, about half an hour train ride away, or 35 minutes from Copenhagen. So it is a great spot to be able to kind of go off and explore other parts of Europe now that the world is opening back up a little bit for that.
Mm-hmm.
Yeah, last but not least, Catalina, what brought you to the public health program?
Well, I was actually looking for programs for the masters, and Sweden was one of my first choice, to be honest. And I was hesitating at some point between Sweden, Germany, and Denmark, and then Lund just show up, and I started to look at the program. I would say a couple of years before I actually applied. So in the end, when I have to choose, it was easy. I like how the program was presented. I also like that when I sent an email to the director of the program, he answered me right away. He was really nice. So I like that. I appreciate that because I feel like the university was close to me and like in a friendly way. So in the end was the first choice because I feel like it was a warm environment and it was friendly as well.
Oh, that's so great to hear. Thank you. And we have a question in the chat, which actually ties into what I wanted to ask next anyway. Someone asks if we can talk a little bit more about the learning environment, specifically for the Master in Public Health, but I'd be curious to hear about this from all of your programs. Is there a lot of teamwork or a lot of individual assignments? So perhaps we could go around and talk about that. What's the learning environment like? And in general, kind of what's the course structure like for the courses in your programs? So the student asked particularly about public health. So we'll start back around, perhaps with you, Catalina, this time.
Okay, yes. Well, first of all, we have both individual and group assignments, which is quite challenging, but it's also interesting because you are working all the time. You learn how to work alongside your classmates and do a good group effort, I would say. And you also have the opportunity, like it's not the same group all the time. It's random as much as possible. So you are not able to choose your own group, but it's part of the system, I would say. And I like that because thanks to the system, I had the opportunity to work with a lot of my classmates so far. So it's a good way to actually work and reduce any kind of bias because I don't know, feelings or whatever. So I would say that. I don't know if Samu wants to help me with something.
I agree with Catalina. You get to work. Sometimes if you're not used to group work, you might feel like it's a lot because you have a group assignment for each subject you do. So and that means always having to work with new team members. So you might find that a little bit challenging at the beginning, but as the more you do it, the easier it becomes. And like she said, you get to work with everyone in the class. So I think by the end of the program, you would have worked with every single person in the group. So yeah, that is quite a nice way to do things and get to know each other as well. Yeah.
Great. Justice, do you find that that's the same in medical sciences?
Yes, I think I agree with what my colleagues have just shared. So at the end of the day, you get to work with almost everybody in the class. You are able to co-create your interaction, and you have different perspective of almost everything you do in the class. Yeah.
Wonderful. And what about biomedicine, Agnes?
I believe when I did the Bachelor, it was quite individual. But then later on, we had a lot of more group works, and then it turned back to being very individual again. Here in the Masters, it's a lot of group work. There's a lot of how to cooperate and how to have a good team dynamic. That's the main focus, I think, in the Master as well. But now coming up with the thesis and everything, you write everything by yourself, which could be challenging, both in the bachelors as well. To just it's quite a big thesis. So, but in general, I think you need discipline and you need to know that you have to kind of work hard on your own. But there's always like, you can always sit with your friends and you can always study together, but there's a lot of tests and assignments and papers that you do by yourself. But there's a lot of other, like in class, there's a lot of seminars and PBL and TBL. I don't know if you're familiar with that, but we use that a lot, which is team-based learning and problem-based learning. So you always work in group in class. but the big assignments are on your own, basically.
Sorry, maybe if I could add this, that there is this that happens usually in my class. You maybe for a week, you might tend to attend just a 3-hour lecture, and then the rest of the days, the rest of the 4 days is an individual study. And if you are not very careful, you might think they are free days for you, but those are the days you actually need to work on your own. If you mess it up, that means you are messing up with your academic work. Yeah.
That's a great point, Justice. I'm glad you brought that up. That's something that I know a lot of students are quite surprised by when they come to Lund. It varies, of course, a little bit depending on your program, but there can be a lot of programs that from at least certain times that you find that you are not going to be necessarily in class from 9 to 5 all day long in your lectures. There is a lot of time devoted to individual work and group work. So even if you're, as Justice said, not in class, that doesn't mean you shouldn't be working. There's a lot of emphasis here in Sweden on kind of being able to manage your own work outside of class as well and committing to that. So that's a great point. We have another question here who's asking about the research and the facilities, specifically in this case for biomedicine, but that's also something I'd love to hear more about from everyone. If you could share a bit about both, maybe we'll take that in 2 questions because that's a lot, both research and facilities at once. So maybe we'll start with the research opportunities. Are there any options within your programs to get involved more in the research side of things? Agnes, if you'd like to start with biomedicine, and this student is particularly interested in the bachelor's, but it'd be good to hear about both.
I think for the bachelor's, you can each summer apply for what we call summer projects. So that's a 10-week summer project that you do at a lab of your choice. So you contact them and ask, hi, can I be here for the summer and work for you? And you actually get a bit of a scholarship during those 2.5 months. So you get also a bit of a pay, you can say. And that's a really good way to get involved in what research you like and also try out different types of research. Like you can go into neuro, you can go into obesity, you can go into stem cells. There's a lot of different ways, but summer research is really, really good, and that's a great opportunity. And you can do it during your bachelor's in the summers. And the same goes after you've done that, you can actually the next summer apply for a summer research school, which is in more in depth how to get involved with research as well. So yeah, there's definitely opportunities. You could also do it during your studies, but that's quite hard because it's a lot of studies. So if you want to have a kind of part-time job in a lab, you really have to be prepared that it's a lot of work. And I don't have many friends that have done it in the bachelor's at least, but many have done the summer research school.
Great. Samu, what about the master's in public health? Do you find you get a lot of opportunity for research?
Yes, but I think that only comes up a little bit later on in the program. Like Agnes mentioned, I also partook with the summer scholarship, but that only came during the summer in my first year. So after that, that's when you can actually get involved with research that you're interested in. So currently I am researching with the health economics group. So that's what I did in the summer, and I'm going to be writing my thesis with them as well as prepare a paper for publication. So there is opportunities, but I think specifically for the public health individuals, it will only come up if and when you want to do the summer scholarship.
Great. And Justice, what about medical sciences?
Yeah, to the best of my knowledge, there are projects you could be invited to, but those are individual professors' projects, and you get access to those ones when you are getting ready to start your master's thesis, and that will be in the second year. But for the summer courses, and that I am not aware of, that you have the opportunity to get to roll on to. So that is what. And currently, I have been invited to a project by a professor, which I'm going to do as a master for my master's thesis. Yeah.
Great. And then the other part of this question I wanted to ask about is the facilities. So for those in the audience who aren't aware, our medicine faculty has two locations. They have buildings and facilities in our main campus in Lund, and also a building called the Clinical Research Center and the Wallenberg Laboratory, which is located in Malmö, which is only about a 15-minute train ride away from Lund. And it's in Sweden's third largest city, and it's connected there right next to the Skåne Regional Hospital in both cities. So you have a lot of connection in the medical faculty to actually being very close to the hospital and where everything's going on. But I know definitely the Masters in Public Health is located at the CRC in Malmö quite a bit, but Justice and Agnes, I'll admit that even I myself am not quite sure whether you are spending most of your time in Malmö or in Lund. So could you share with us more about what the facilities have been like there? Justice, we'll start with you.
Okay. We are located with HSC, that is the Health Sciences Center here in Lund. And for the facilities, yeah, I'm sure there are quite a number of them that you can use to work with. You have a library, you have databases that you can, once you are a student, you are able to get access to with your student account, which enables you to have all the data and all the articles you need to work with. There is also an assistant from the library that if you are stuck in doing anything of the sort regarding your research, you are able to contact them and they are able to support you regarding what you seek. Yeah.
Great. That's also a great point. We have 26 different libraries at Lund. So you, of course, will find books for your courses in your subject area's library, but you are able to use all of them for different study spaces. And there is always a specific librarian for your program, as Justice mentioned. So they know kind of what you're working on in your projects and are able to help you more specifically about what's going on in your courses. So that's great to point out. Catalina, how is it studying at the CRC in Malmö?
It's actually really good. The building has a lot of facilities to study, including, of course, the library that is really good. And you have, of course, access to all the material that you need for the lectures. And also, it's a good way to share with your classmates if you want to do something in group. We also have other facilities besides the library. And it's actually a really nice campus, and you are close to Pildammsparken. That is a really nice park. If you want to maybe take a break or something, it's a good way to do it. I don't know what else to say. Well, since of course due to the corona, last year we couldn't spend too much time in the campus. Nevertheless, if you wanted to go to the library, despite the corona, they had some opportunities to the students to go there. So you can do it if you want to often or whatever you want to do about that. But yeah, the classrooms are really nice. We have a big classroom when you have like I would say the lectures that are more like seminars or something. And then you have a small classroom when you have to maybe do a workshop or things like that. So it's nice. I mean, the facilities are really friendly, and yeah.
Great. And Agnes, how about the biomedicine facilities? I imagine you're in the BMC most of the time, or correct me if I'm wrong.
Yes.
Yes.
Yeah. We it's the biomedical center. So it's there's the student center where most of us study, and we have our lectures and everything. And it's wall to wall with all the researchers in Lund. So that's really cool. I don't know, there's mostly like study halls or study rooms, but it's very crowded. So if you were to just study, I would not recommend to get a room there, because it's often booked and it's crowded with the medical students, because we study at the same facility. So yeah, other than that, it's very cool to be very close to all the research being done in Lund. So it's very neat.
Definitely. And the BMC is in Lund, just to clarify that there.
Yeah.
So if you're interested in studying either a biomedicine program or medical sciences program, you'll be in our Lund campus. And those of you interested in the public health program will be at our Malmö campus. But again, they're only about 15 minutes away from both of them, so by train. So you're pretty well set to be at either. Great. We have another question here that I think will be very interesting to hear about how many students are in each of your programs. And I'd like to even add on to that, how many students are in your programs, and also what's kind of the breakdown of international students and Swedish students, because I know that's also something quite a lot of people ask about. So Samu, how about in the public health program?
We are, I think in our class we're 38, but I think the program aims to have 40 students each year. So it's a big class, and we have, I think we only have 3, if I'm not mistaken, Catalina can correct me, 3 Swedish students. The rest of us come from different places. So you will get a whole lot of different nationalities. Yeah.
Great. Agnes, how about biomedicine, both for your bachelor's, how was that, and for the master's now in terms of size?
Oh, in terms of size, yeah, I didn't go to the international bachelor program, but there we were also 40, similar. And I think we dropped a lot, though, into like 25 or something. But now the classes are very big in the bachelors. Not a lot of people are dropping out, so that's great. And for the masters, it's similar. We're 40. But now we're divided because you go into 2 different tracks in the second year. So yeah, and when it comes to Sweden, Swedish and non-Swedish, I think we are maybe 10 out of, no, maybe 8 out of 40 are Swedish, and the rest are, it's super international, like US and Indonesia, and yeah, it's very diverse.
Great. And Justice, is it around 40 as well in medical science?
Yeah, I think like someone said, the program aims to have 40 students, but currently we are 12. In the first year, we were 13, but I think 1 dropped out. So currently we are 12. And the Swedish, I can count in my class, I think there are 3 currently, but other nationalities, just each of us, yeah. So from Ghana, from Ethiopia, from Malawi, from Italy, from Brazil, and we all have different backgrounds. Everybody has different backgrounds in the class, but the program aims to synchronize all of the learning activities into one. But at the end of the day, we have specific areas that we work towards. Yeah.
Great. Thanks. And I'd love to ask as well about what the relationship is like in your programs with the professors. I know that's something that sometimes can be quite surprising to students when they come to experience sort of the informality in Sweden, but what has that been like? And maybe Catalina, we'll start with you this time.
Okay, yes, the professors overall are really open-minded to talk with the students. They are aware about the fact, like, it's not a vertical relationship, but it's quite the opposite. So they actually facilitate if you are, for instance, facing something specific that you need help, you can contact them without any kind of hesitation, and they're gonna be able to help you or to listen what you want to say or want to do. And they are not, how can I say that, like, they are not bossy around or something. It's quite the opposite. They actually are aware about specific matters that we can have, and also they are wondering all the time if we are learning, if we feel that we are learning in a good way, especially, for instance, with programs like those related to biostatistics. So they are really concerned that you are learning everything. And yes, I mean, and actually the faculty have resources to facilitate to the student if the student is facing a specific problem. So for instance, as Samu introduced herself, she's a student representative, so you can also talk to her if something else happened, but also you have a student advisor, and the student advisor is close to the professor as well. So you don't have to be concerned like, oh, I feel too ashamed because I'm facing a specific problem or whatever. You can talk with the professor or through the student representative or the student advisor. So it's really cool. Yeah.
Great, wonderful. Samu, is there anything you'd like to add there about the professor-student relationship in public health?
I think what also makes the difference is that the way they interact with you, they also want to make sure that you enjoy studying. So they are very carefree. They want you to have fun while learning, as much as they want you to understand that we're here at school, yes, but we also need to have fun. So that is also quite nice. So that might be a little bit surprising if you're not used to having that kind of free relationship with your teachers. And yeah, especially for someone like me, we call our professors by their names. There are no professor who and what, so you just call them by their names, which was quite surprising when I came here. So that is actually quite nice, because that kind of makes you feel like you're on the same level to an extent. And yeah, that is really nice.
Great. Justice, I see you nodding your head aloud there. Has that been your experience as well?
Yeah, so it's same that applies, and particularly if I want to cite this example, I arrived late last year due to the restrictions, so I missed my first course. Apparently, I had joined the course, I think 10 days to the end of the course. So I had a lot to catch up with. And the professor of that course has been really, really, really helpful. It wouldn't happen in my home country. So that is the kind of relationship we're talking over here. And for the faculty to also have a student counselor who is always there to support you. Are you catching up? Is there any problem? They are just willing to really help you sail through your academic tasks. Yeah, so that is what is happening. Yeah.
Wow, that's wonderful. Thank you. Agnes, what has the relationship with professors been like in biomedicine? Was it very different between the bachelors and the masters, or quite the same?
No, I think it's quite the same. Same with high school. It's no different than high school. I think it's just you call them by your first name, and it could be a bit intriguing sometimes, but they're just friendly and they just want to help you, and they're also just humans. So it's very kind of a flat organization thing. It's just no hierarchy or no titles. It's just people helping people. So they're really, really friendly, and you can always email them or go. No question is stupid. It's just ask things. You won't be judged, and it's just be curious. I think that's one of my main tips, and just don't be afraid to ask, because they have all this knowledge. So just ask, and they'll help you. And if you're confused about something, they will also help you. And I think just in general, most of the professors or such that have the course are very interesting about feedback. They really like feedback on the things that they do. So like course feedback is like a key thing, at least in biomedicine, that they always send out these surveys almost after every lecture, like what was bad, what was good. And so I think they really care about the students as well. So,
wow, that's wonderful to hear. Thank you. We're a little bit over halfway through our time, so I just want to remind our audience, if you have any questions, please feel free to post them in the Q&A so we can answer them for you. That's what we're here for today. And I'd also like to ask you guys if there is much opportunity for flexibility within your programs. So do you find that the courses are quite structured out and you have everything kind of planned out for you? Or is there some flexibility if you wanted to take an elective or if you wanted to dive more into a particular area of your interest within the courses? What's that like in your experience? Samu, we can start with you.
Okay, so in the first year, you have an opportunity to choose one elective. And then in the second year, you have an option to choose 2 electives. And one of those electives can either be an internship or you can do a course. So there are 3 ways where you can choose which way you want to go, basically in the course, but most of the stuff, because it's a professional program, you have to do prerequisites course besides those 3 elective I have mentioned, yeah.
Great. Justice, I see some nodding. So does that apply for your program as well?
Yeah. So in my first year, for instance, I had the opportunity to choose one elective. Of course, the faculty also has an option for you. So you could either decide to do the proposed course by the faculty, and the second year is same. You could decide to do that here in Lund or elsewhere that has the course you want to do. All you need to do is to make sure that the period are able to match, so that whilst we have the course here in Lund, it is also going on wherever you decide to pick the course. Yeah.
Definitely. And Agnes, what's the options for flexibility in biomedicine?
Depends on if it's the bachelor or the master's. So for the bachelor, it's very set. You have your courses, you have your thesis. The thesis, of course, is elective, because that's all up to you to find a research group that you want to do your thesis in. However, for the master's, there's one semester that is full of electives, and here you can pick and choose what you want. There are program-specific courses that you can take that are very within the field, in biomedicine field. But if you want to do something different, if you want to do entrepreneurship or something similar, that's also an option. So there's definitely electives in the masters. Yeah.
Great. And I noticed, Agnes, you put in the chat, that's a great point as well. For those of you studying or looking to study medical sciences and biomedicine, part of the campus is actually under construction now. So as Agnes posted, you can see here the new Forum Medicum will open in 2023 and will actually combine both of the facilities that we're currently using for those programs, which is a really exciting new project. So those of you who would potentially apply and enter next year, by the time you enter your second year, you'll be in an absolutely brand new facility, first one's using it. So that's quite exciting as well.
Yeah.
And since you brought up the thesis, Agnes, I know all 4 of you are going into your thesis quite soon, if not already. So do you feel that throughout the program, how have you been prepared for that thesis? Or is there any opportunity? I know some of you have mentioned about being able to connect a research project or an internship earlier on that you do to your thesis. Can you tell us a bit more about that and how you feel prepared for the thesis? Catalina?
I think,
or Agnes, we can start with you.
No, sorry. You can
go for
start.
it.
I think for the bachelor's, you can do the summer research school, and then you can, maybe if you like that research group, you can continue to do your thesis. And I think for the bachelor's, they really prepare you well, and they list all the requirements that they want from you. However, for the master, it's very individual work that it needs to be done, because you've done it once and they kind of expect you to do it and nobody's holding your hand. So it's yeah, there's a lot of doing it by yourself, which could be quite scary, but yeah, if you have any questions, you can just email them and they will clarify anything. So that's nice.
Great. Catalina, how about the public health program? Have they been kind of preparing you as you go through for the thesis, or what opportunities are available for that?
We had a meeting on May before the summer break. And in that meeting, they introduce the options that we have to do the thesis. So of course, you can do connections through your internship, or if you do the summer project, that is also a good idea to have connections to them, in order to actually get already a topic or a group that can support you in this process. Otherwise, you can do it by your own, but of course you have to follow some steps, and you have to have a strong connection with the faculty all the time, with the program. So otherwise you can actually lose your job, and that is not the idea, of course. But yes, they support you from the beginning, since you have to accomplish several steps before start your thesis project in January next year. So yes, I would say you have a good support, and again, you have those options. And actually, a lot of our classmates, they do that through the internship. That is a good way. And also, you can be aware about the research groups in the faculty, and you can start to send emails to them, and according to your personal interest and everything. And if they say yes, you can also work with them. I mean, it's up to you, but you have options. Yeah.
Great. And Justice, you mentioned you already have the professor that you're going to be working with for your thesis. So how was the process of sort of finding that? And was it the same for most of your classmates?
Yeah, so like I did say, they had an existing project, so they needed, let's say, someone to conduct a project on a thesis on the project. So I got invited, and since it was linked to my background, I accepted the offer to really do that. And I think the topic is really interesting to deal with. I'm going to do something on people with dementia, and what has already happened is that from the beginning of the course, how you must conduct research is being taught. So from day one, that is what I've been doing over and over and over and over again till now. So to a large extent, I feel that I have that knowledge to really start up. But in any case, if I'm stuck, I'm sure I have a supervisor who is there to really guide me through the process. So that is it.
That's great to hear. So we have a question here in the chat now that I think would be relevant for everyone. Sophia asks, how much time would you say you spend on studying? Is it sometimes hard to find time for activities like grocery shopping, working out, etc.? So I don't know if anyone in particular would like to start with that. Justice, you're turning your mic off, so perhaps you'd like to go first.
Yeah, what I would say is that once you are admitted to a full-time studies, at least you should spend 8 hours studying or committed to your assignments or something of the sorts. Because if you don't do that and you have a different background, especially if you are not a Swedish, so you need that time to really get into what is being required of you. I think 8 hours in the day would allow you some time to go for shopping and other stuff if you are not studying, or you feel that you've done this and it's okay for the day. So that is what I will recommend, and it's a personal opinion I'm sharing here. Yeah.
Definitely. I think it'd be safe to say it's comparable to working full time. I mean, if you work 8 hours a day, you still have plenty of time in the evenings and different times to do other activities. But Catalina, would you agree?
I would say in the beginning, you have like, maybe you might be too ambitious, try to accomplish everything at the same time. Like, oh, I want to work out, or I want, like, you feel like maybe, I mean, you might have this concern that you are not able to aware everything or to do everything. But in reality, and something that you learn here in Sweden, since you have intense course. It's not like, for instance, in Colombia, when you study a semester, you have to do all the courses at once, but at the long of the semester. So here is different because you do one course per time. So you have to actually be really organized and try to accomplish your assignments on time. And you have to manage your free time in a different way. Because that was my mistake at the beginning, that my first course, I thought like, oh, I have a lot of free time, and then was like, oh no, it's not free time at all. It's like you have to actually run and to organize and everything. But once you have adjusted to this kind of system, it's actually possible to have free time to do your workout, or if you want to go for a hike, or if you want to share with your friends. Because the system here in Sweden, they encourage you to have activities like hobbies for your free time. It's like not everything is about the studies. So yes, you have to be focused on your studies and try to organize yourself, but in the end you can do it.
Definitely, great. I'm being conscious of time, so just so we have time to get a few more questions in. Samu, Agnes, if you have anything to add there, you can, but otherwise we'll go to the next question. I think it's safe to say that it's, it's really up to you how you manage your time, but you should feel like you have time to get your studies done and still enjoy some free time as well. Yeah, great. We have another question here about if there are opportunities to learn Swedish if you're interested as an international student. I would say first, there are. So all of the programs in medicine and health are 2-year programs. So that means there's a course from the government called Swedish for Immigrants, which is free and is offered as an option to help you learn Swedish, as well as a lot of different resources online. There's a lot of language cafes and things around Lund that can help. But as an extension of this question, I'd actually like to ask our international students here sort of about that. Are you learning Swedish, or any of you taking advantage of that? Or do you feel like Swedish is something you need to learn to get by in Lund? Or that's something I know a lot of students are concerned about, that they might need to learn Swedish in order to go through their day-to-day life. But what has your experience been like that? I have a hunch, but I'll let you speak for yourself. Maybe Samu, if you'd like to start.
Yes, I'm learning Swedish through SFE. I actually have a lesson tonight after this. And I work as a babysitter for a Swedish family. So the little kids that I work with only speak Swedish. So I was kind of thrown in the deep end with learning Swedish for myself. So I have been learning Swedish. I can hold a conversation with a 7-year-old. But yeah, there are opportunities to learn, and I don't think you necessarily need to have Swedish to be able to go through your day-to-day life. Like even in the grocery stores, you will be able to do your shopping with English, and you will pick up things along the way, even if you don't go for formal lessons. Yeah.
Great. Justice, has that been your experience as well? Are you learning Swedish, or find that you need Swedish?
Yeah, basically I'm able to do my daily activity with English though, but what I do to try and catch up with little Swedish words is that the handbook I have been given, sometimes I read through because it's advisable. It is in the book that in case you want to step out, you should just try and translate what you are going to do into Swedish and try and practice it when. So those are some of the things I do. I have not really started SFE yet. The plan is that when I'm done with the study, then during my 1-year extension, I'll try and focus on that. I try to use Google Translator to help me get around. Yeah.
Great. And Catalina, anything to add?
I'm also learning Swedish through SFE. I'm in the distance learning program. So it's a quite experience because you have to be like more autonomy, like you have to privilege your time and try to organize even better. So I would say I'm not able yet to speak because I'm too shy to speak in Swedish, but I can read more now, which is good. And I would say for me, as Samu says, it's not viral all the time, but if you want to go to the doctor, maybe it's good if you have some knowledge in Swedish, because for some reason that I cannot explain, it's kind of hard sometimes try to speak with a doctor in English. So I would say it's good for these kind of things. And also because even if Sweden is a friendly country when you can actually speak in Swedish, in English all the time, you might be need to understand Swedish because some of the letters from the government and those kind of things are only in Swedish. So it's good to have this knowledge if you want to, of course, like somehow get more engaged with the culture. But otherwise you can live without Swedish and it's also fine. Yeah.
Definitely. And speaking of Sweden, I'd love quite quickly, since we're coming to the end of our time here, to hear maybe what has surprised you most for the three of you as well that were new to Sweden. What surprised you most coming to Sweden, or something that you're really enjoying about Sweden, but you maybe didn't expect? Perhaps we'll go back around the other way. So Catalina, you can go again.
Okay, yes, I really surprised, like Swedish people really enjoy sweets, all the candies, they love it too much. I was really surprised because I thought like, I had a different perspective from Sweden in that way, but it's amazing how they love sweets, and of course fika. That is like a traditional traditional thing here, that is with you drink coffee with something sweet, and you have that as an excuse to share with your friends or your co-workers or your family or whatever. So I was impressed about that, I would say.
Yeah, everyone arriving to Sweden will definitely experience a lot of fikas during your time here, for sure. Justice, what surprised you about Sweden, or what's something you really enjoyed about living here?
Yeah, so what surprised me was a culture shock. When I arrived, because I didn't know, I arrived late and I didn't know my way around. I tried to approach someone to just ask a question, and the person was nay, 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 nay. I said, wow, because where I come from, it's easier for you to just approach someone in there. You could be spoken to, but in this case, I was like, hey, okay, I said fine. So I just have to wait till I'm able to get around. And what is interesting is that, well, I can't think of anything now. Yeah.
Okay, that's a interesting point, because I think definitely Swedes are not the sort of people that talk to strangers too much, but usually, hopefully, they're usually, in my experience, quite willing to help if they realize you need help. Maybe that person thought you were trying to sell them something rather than ask for help. But yeah, Samu, how about you?
For me, I think what's really been interesting for me is my ability to get anywhere with my bike. So I really love my bike here. It just takes me 10, like in Malmo, it takes me 10 minutes to get to wherever I want to get, whether it's on campus, to the station, to the shop, just 10 minutes. So I really love my bike. But just to add on to what Justice was mentioning, like, yes, people mind their own business, but like if you're in distress, people will help you. They will stop and then they will try to help you along your way. So that is also nice. Like I fell off my bike one time and people stopped and they tried to help me out. So yeah.
Oh, that's good to hear. Well, since we only have about 5 minutes left, if no one else has a question in the Q&A, I'd like to, as our final question, ask if any of you have any last advice or tips you'd like to give to prospective students who are considering your program, or if there's anything that you think is really interesting about your program that we didn't get a chance to mention yet. What would you like to share with other students? So Agnes, since we haven't heard from you in a little bit because of our Swedish related questions, we'll start with you. What do you think would be some good advice or last tips for students studying biomedicine?
I thought the question was more in general, like coming to Lund, but
it can be. I mean, either one. Coming to Lund or coming to your program.
When you come to Lund, invest in a bike and a raincoat. That's what I wrote down. And when it comes to biomedicine, it's really just about being curious about everything. So I think just have a good mindset and try to be curious throughout the education and ask questions. There's no silly questions. And take all the advantages of networking and speaking to people. And yeah, it's a great opportunity.
Oh, great. Samu, what would be your advice for students considering public health? Or Lund, can be more general too.
I think if you have, like, if you're still not quite sure, like Catalina mentioned earlier, email the program director. They will be able to help you. It will help you along, especially in this period when applications are open. The other thing is, if you get to Lund, like Agnes said, take all the opportunities you have to network. And we also didn't mention there's this thing called office hours. You should also use those quite well because they can be very helpful in your journey as well, and as a student.
Absolutely, that's great. Catalina, anything to add? Your tips for public health?
Not really. I mean, I would say, as Samu mentioned before, and also Agnes, that don't hesitate to ask. It's not a silly question there, and it's important to share if you are facing any kind of concern. Also, we have this information often in the beginning of the semester, but then suddenly you can forget it. And it's like, if you feel overwhelmed, for instance, because the winter is coming, or because you face a lot of pressure because your assignments, you can also ask for help with the healthcare center that we have in the faculty and also in the university, which is really good. And you can actually participate, for instance, in the procrastination group or the stress group as well. And also, if you need counseling, you can ask for it as well. So don't hesitate to keep that in mind. And since I mentioned winter, it is important to realize that you have to take precautions about the darkness, because it's really hard here, especially if you came from a country like mine, when in Colombia we never face this kind of change of lights. So it is important to actually wear a watch, for instance, and also try to keep in mind that you are not losing your day, because you cannot depend on the lights of the sun, because the sun is gonna go on anyway. So and you can do your daily life without too much stress, I would say. So yes.
Definitely some good health advice there from our public health students. Great. And Justice, we'll end with you. What would be your advice for students studying medical science?
Yeah, so I would say, if you are admitted to medical science, what you have to do is to just get focused and be determined that once others have done it, you are equally able to do it. And like my colleagues did say, there is no wrong responses to any question. Even if you have tendered in perhaps a task and there is a revision to make, all you need to do is do it, and you attain the pass mark for the grade. Just get determined and you are able to say true. Yeah.
Great, thank you so much. Well, I want to thank all of our panelists for being here today. It's been really great to hear about all of your experiences studying medicine and health. It's always fun for me as well. I always learn new things about our programs. And I want to point out to those of you left in the audience, I've put a few links here in the chat, as has Agnes. If you want to follow the medicine and health faculty on Facebook, Agnes has posted the link there. Thanks for that. And if you have any questions after this event, I've posted the link where you can contact the staff, my office, if you have any questions for us about how to apply or anything like that. All of our students here are also student ambassadors who you can actually chat with at any time. So I've posted the link there too. So if you have any questions that you think of later in the day or in a few months, feel free to find them there and continue the conversation. And as I mentioned, we do have a lot of other virtual events coming up. We'll have another program coordinator webinar for the coordinators from public health during our application week in a few weeks. And we have a lot of webinars all the time helping you with how to apply. So be sure to check that out and join. And thank you to our audience as well for joining us today. It's been great to hear some of your questions, and we hope that you found it useful. So I wish everyone a great rest of your day, and thank you so much for a great session.
Thank you.
Thanks.
Thank you.
Bye.